Well, in 2020, we knew very little about the novel virus that was to become known as COVID-19. Now, we've entered 2023. A search of Google Scholar produces around 5 million results containing the term COVID-19. So how will the pandemic be felt this year? We're also seeing a number of countries reacting to, China's latest decisions and the fact that they are recording more cases. Well, to answer this question and more is the Director General of the Nigeria Center for Disease Control, NCDC, Dr. Ifedayo Adetifa. Happy New Year to you, and thank you for joining us on the program.
Happy New Year to you as well, and thanks for having me.
First, what's your take on what's going on in China with the virus, the coronavirus?
China is seeing a resurgence or increase in cases associated with severe illness, hospitalization, and deaths. This is associated with their transition from the zero COVID strategy that they previously had, which when combined with the fact that there appears to be insufficient coverage of the population with vaccines that are known to have the highest impact against severe disease, hospitalization, and death, means that as far as transmission is concerned, China, or a significant proportion of its population, is at the stage where most of the world was about almost 2 years ago.
One wonders why. Okay. Well, one wonders why, because some people have questioned that perhaps, I mean, this is a country that has one of the largest vaccinated the largest number as well. Is it the type of vaccines that has led to this, or do you think perhaps the COVID zero policy was the problem?
Well, it's a mixture of things. China's given out mainly or mostly vaccines that were manufactured in China. Two types. The impact of those vaccines against what we'll consider clinically significant outcomes, such as severe illness, the need for hospitalization and death, appears to be less than is seen for all of the other vaccines that were more popularly used elsewhere and in Nigeria, for example. But in addition, the lockdown and significant restrictions that were previously implemented in that country also means that even natural infection has not been allowed to happen to the extent that it has been seen elsewhere. So there are also no benefits from whatever boosting or natural protection that would have been conferred by allowing by natural infection, as has been seen elsewhere. Back to you.
One would think that they are sort of experienced in handling coronaviruses, and that this, could have been better handled. And this is also working towards, that policy, which is the zero COVID policy. I mean, the WHO at the time said that they needed to review that policy. And I personally thought that, they were doing well initially, but then we had the protests and then the economic impact as well. I'd like to get your thoughts on, what some EU countries are doing now, several of them imposing restrictions. Do you think that these measures are justified?
I think that, the Nigerians are rightfully concerned about what's going on in China. A lot of what's going on in China has been put in the spotlight because of travel advisories, mainly negative testing, or the requirement for negative PCR tests from travelers coming from China into countries in North America and in Europe, which I think is swayed concerns somewhat and is providing a bit of distraction even for the Nigerians that are concerned and people in other parts of the world. When we look at the data, we are seeing upticks in cases, in case numbers, in hospitalization, and in deaths. In many countries in the world, of course, some of this is associated with the winter exacerbations that we see for respiratory illness. But the data that is available shows increase in cases in the UK, increase in cases in the US, increase in cases obviously in China and elsewhere. So from our perspective, we are looking at risk across all countries where there's potentially traffic or travel, likely travel from Nigeria to and fro these destinations, and not just China alone. The other thing we know is that in addition to the recent transition from the zero COVID policy, there are concerns about that there might be new variants or Omicron babies that may also be contributing to the uptick in cases. Specifically for China, there is talk about a B.5.2.1 Omicron sublineage or baby, as well as something called the BF7. Our genomic surveillance shows that as far as July and August, we already had B.5.2.1 in the country and circulating, and that was not associated with any increase in cases. At the moment, we haven't seen any BF7, which is the other Omicron baby that is people think is responsible for or contributing to the uptick of cases in Kenya, in China. But we are waiting to, of course, update our genomic sequencing results with the December data. The other thing is for the US and the UK, they are they have the XBB 1.5 variant as well, and other XBB-related variants are thought to also be behind the uptick that they are seeing in cases. We have seen XBB variants in Nigeria already from previous months. We haven't specifically seen XBB 1.5 or yet. That may be in the December compilation of results when we get that. But I think the thing we need to highlight to citizens is that as far as we are concerned at the NCDC and the Ministry of Health, we are looking at all countries where there's potentially risk, and not just the spotlight that has been placed on China because of restrictions put in other places that also have uptick in cases that we are paying attention to and should also be a source of worry if anything changes or if they continue in the same trajectory that they currently have. However, and I will close by this, is that we need to, if we're taking on board lessons from the pandemic from more than 2 years of responding to it, we need to remember that these actions, whether it's requiring PCR tests, negative PCR tests as we try to do for Omicron, they didn't really do much or do anything in terms of preventing circulation of Omicron when it first emerged. We are not dismissive of the possibility that we may have dangerous Omicron babies, but the facts that we currently have at hand do not suggest that we should expect any rise in cases or any rise in severe illness at the moment. But as I said, it's a rapidly moving situation. We will continue to evaluate, we'll continue to gather data, and we'll continue to review weekly. And it is possible that when we look at the data that has accumulated in the elapsed period, later in the week when we sit down to review the scenario, we might see evidence to inform decisions or actions that will be put in place to try and protect citizens. But at the moment, we haven't seen any reason for that to happen yet. But as I said, it's a rapidly evolving situation and we continue to watch.
Just before we let you go, is there a new direction for the NCDC, and this is taking into consideration diseases for 2023, and this is of course in line, you've mentioned how you're waiting and observing what's happening with COVID-19?
Well, I'm not sure what you mean by a new direction, but what we certainly know or that we are sure Nigerians will happen is that the headlines do not always reflect what the NCDC and other agencies are doing in terms of our health security. We continue to look after or look out for all of the pathogens that are of relevance in terms of their likelihood to cause threat to public health, regardless of whether they are making the news or not. So it's Lassa fever season. We are keeping an eye on that. We still have an ongoing monkeypox outbreak. We are still managing that. I wish there's a bit more attention being paid to the fact that we are still dealing with a significant number of cases of cholera across the country. We are still responding to that along with partners in the states. And we know that with increasing human action in the environments that we coexist with animals, we expect that the threat of other zoonotic illnesses will continue to persist through the year. And we continue to look out for any emerging or reimagined pathogen that may be a threat to public health. So our focus is survey. We will continue to work on strengthening our surveillance and to increase its sensitivity to be able to detect the next likely outbreak so that we can be better placed to respond appropriately. The second thing is to also take forward all of the lessons learned from COVID, all of the investments that have been put in place from COVID, and to make sure that we continue to merge that into a streamlined platform that will continue to serve our health security and the ability to respond to any threats that emerge in the country. Back to you.
We appreciate your time. NCDC DG, Dr. Ifedaya Adetifa, thank you for joining us on the program. Best wishes of the new year.
Thank you.